Hey everyone, it's Denise Brown from the Caregiving Years Training Academy. Thanks so much for being here, those who have joined us live and those who are watching the recording. We're going to talk about how will we care. Just a little bit of background about me. I started helping and serving family caregivers in 1990, launched a small business to help them in 1995, and have continued helping them for the past however many years that is. And then personally, I started helping my dad in 2004 and helped him until his death in July of 2023. So just a little over 19 years. And I helped my mom for 7 years. This presentation is something that I do on a regular basis. I wasn't able to do it the past few years because every time I tried, something happened with either my mom or my dad or both of them. So the first time I did it was 2018, and it was at a request of attendees to our National Caregiving Conference that I used to host. And they asked me to put together a closing session. And this was the first iteration of today's presentation. So I've updated it over the years. If you are joining live, feel free to share any questions, insights in the chat room as we go through today's presentation. I'd like to start with a request, and that is to let go of the idea that family caregivers don't self-identify. I've actually been talking about this for over 20 years and really asking people not to say this. There's a couple reasons. First, we do identify. We are identifying all the time what we do. We are identifying in the healthcare system by showing up in doctor's appointments. We are identifying in the hospital system by showing up and being there in the hospital room all the time during a hospitalization. We are showing up in the community with our carees and their obvious disease process or challenges. We are showing up all over and showing everyone what we are doing. So we are identifying. And it doesn't necessarily matter whether or not we call ourselves a family caregiver. We are identifying that we are someone who helps someone else. One of the reasons that this is a dangerous idea to continue to share is that it became the default excuse when companies went out of business, when family caregivers didn't use their product or service. So rather than thinking through, why aren't family caregivers using my product or service? The startup would say family caregivers don't self-identify, and that's not why they're not using it. And that is not true. They will use products and services that will help them. So we're not hidden or invisible. It's just a reimbursement issue. The system, until recently, and we'll talk about that, had no way to be reimbursed for helping or supporting us. So it's not about the fact that we don't self-identify. Again, we show up and show everyone, everywhere, what we do. It's that within the systems, like the healthcare system, they could not be reimbursed for helping us. They weren't paid to help us, so they didn't. Okay, so let's look at the numbers. 53 million and growing individuals who care for a family member. Look at that number in comparison to the number of physicians, 1 million. So we are the largest group of healthcare professionals in the world. Let's take a closer look at what that's like. So as we think about the future of caregiving, caregiving is going to be a part of our lives going forward. It could be just short term for a little bit of time while we help someone recover, for instance, from hip replacement surgery, or long term, what we think traditionally as a caregiving situation where we help someone over a period of years and decades through their disease process. And as we think about that, we also have to think about, is there going to be enough? Will our families have enough money to hire care? Will there be enough care to hire? Will there be enough services and programs for us to access? Will we have enough money to retire? Will there be enough family members to help? So I would say we're looking at shortages from a variety of different perspectives within a variety of systems. And if we think about shortages, for instance, within the healthcare system, that leads to higher costs, but it also leads to wait lists because there aren't enough, for instance, direct care workers available in a Medicaid waiver program, for instance. So let's take a closer look at that. So the costs of hiring a professional direct care worker through a home care agency rose 14%. And when I did a little deeper dig into why that is, it seems like agencies are incurring higher recruiting costs. It costs more money to recruit potential hires. I don't think that it's necessarily that they are paying their staff 14% more. I think it's that they are spending that much more to try to recruit because they are that short on staff. We also know that there's wait lists for programs available through our state's Medicaid programs, for instance. So there is an organization, Kaiser Family Foundation, that tracks the number of individuals on wait lists. Last year, it was almost 700,000 individuals waiting to receive services. In addition, within the Medicaid program, the Biden administration has said that by July 2027, providers, physicians have to be able to schedule an appointment and see a Medicaid beneficiary within 15 days. And it's 10 days for mental health. So that's coming in 2027. And the reason why, the average wait time for a new patient to see a physician is 26 days. 26 days. One of the reasons that I think through these challenges is because I want to figure out, well, what can we do? So in our training programs, we train individuals on how to help a family manage a wait. And we also help them manage when a benefit ends. And we're going to talk about a situation in Indiana in just a few minutes. So if we think about the costs of care, so if it costs us 14% more this year than it did last year to hire a home care, direct care worker, we are going to have limited funds. We are going to be putting out that much more, but using that much less. So for instance, 10 years ago, maybe we could afford 10 hours of care per week. Maybe now it's the minimum, 4 hours of care a week that we have the budget to pay for. We also know that children are going to grow up in a caregiving situation. We have seen this happen over the years, and there's been more focus on this just recently. The Wall Street Journal profiled teenagers who are in a caregiving situation. And there was another article just yesterday about children involved in the care of a veteran. Caregiving isn't going to be something that happens to us when we're in our 40s. It's going to be a part of our family system throughout our childhood and into adulthood. So this sounds stressful, doesn't it? So let's think through what the stress is. And I really think that a personal caregiving situation can threaten our ability to meet our basic needs. And if we think about housing, food, employment, those are basic needs that sometimes are threatened because of our caregiving situation. There isn't enough. I would also say that it's a threat to our ability to feel present in our day in a relaxed fashion. We are stressed. I started doing a stress survey of family caregivers at the end of 2015. And the stress number has always been at least 4.10, which says to me that stress during a caregiving situation is ongoing. And for those of you who have been in a personal caregiving situation, you know that stress is ongoing. It's ever present, ever present. I also do a survey of family caregivers to better understand what wears them out. So I asked them, how tired are you? 71% said they are very tired or tired. So 71% indicated that on a scale from 1 to 5, 5 being energized, they rate how exhausted they are as 1 or 2. No one said they feel energized. No one selected 5. Then I asked, what is it that wears you out? And it's coping with everything that's happening. Then I also asked, what is it that energizes you? Solitude. We like time for ourselves because there's very little time for ourselves. We also like to be connected to others who understand us. And we like to feel productive. We like to work. What happens during a caregiving situation is that at least 2 fall out of our community. And when I define community, I think about it as at least our business community, our ability to socialize, and our ability to worship. There's more aspects, but those are the 3 that I thought, let's just look at it this way. So the carry is diagnosed and declines, and then is more homebound. And then as our carry is more homebound, so are we. We drop out of the community as well. And when both of us drop out, so does our money. I wanted to learn more about what happens when we drop out of a community because of caregiving situations and what happens to our spending. So I started a survey. This is very preliminary initial results. I'll share updates as I have more respondents. But I asked, what do you spend less on because of your caregiving experience? No surprise, entertainment, travel, dining out. But these are our local businesses, our restaurants, our local venues where we go to enjoy concerts or the theater or movies and travel. Could be a road trip. It could be a trip by airplane. But we stop spending because of our caregiving experience. Then I asked, so what's the impact on you because you do not have the funds and or the energy to spend on travel, entertainment, and dining out? Quality of life. That was one answer. And I thought, boy, that says it all, right? Quality of life. And then another answer really expanded on that idea. My caregiver's exhaustion does not get cured because I don't have time, energy, or freedom to go on trips. I also asked, what influences your spending decisions? And I thought this was so interesting. I guess we could think of this as, of course, it makes sense, but when it became a data point, I was like, wow, our stress influences our spending decisions. And that could be, I'm going to order takeout tonight because I am so stressed out. It also could be, I am too stressed out to do anything like go out. I can't even put together 2 thoughts in my head. I can't think about meeting friends for a meal. Maybe I could, but my stress is so significant, I can't do it. And then the other one is energy level. So here's a question that I thought was interesting. And I used AI to develop this survey. Interestingly enough, first time I did it, I thought, what the heck, let's see what AI comes up with. And AI suggested this question, which I thought was interesting. So do you feel guilty about spending money? And I thought it was great that the overwhelming answer was no. I did a little math about this. Let's say there's a community of 100,000 individuals. And let's just pick a number of 15% of that population is impacted by a personal caregiving situation. And let's say that family caregiver each of those family caregivers cannot get out into their community to spend what they used to. And let's say it was 20 bucks. That once a week they went out to their farmer's market or their local coffee shop or their local breakfast spot. So when they stop spending that 20 bucks, the monthly cost to the community is $1.2 million. Now, that's when I sat down to calculate that, I didn't think I was going to come up with that number, but oh my gosh. Wow. We think about the cost to an individual, the cost to a family system. It's important that we think about the cost to the community. Everybody pays a price when we do not support and help family caregivers. Let's think it through from our perspective as family caregivers. We really look at it from the perspective of money because we are impacted by lack of or by big bills related to a caregiving situation. So we look at money and who that money serves, who gets richer because of our caregiving experience. We pay attention to that. It's also about what we see and its impact on us. And so what we see in our community about who helps who offers what, who listens to us, who supports us. Let's take a little bit of a closer look at the money piece. I started thinking about our budget for care in 2019. We were already talking about the shortage of direct care workers 5 years ago. We knew it was a problem 5 years ago. Pre-pandemic, it was a problem. Pandemic, it's a crisis. And now we're in a catastrophe. When I was thinking about a family having a budget to spend on care, I started thinking about what happens to that budget if there isn't a professional in the community to hire. If you can't find someone to hire, you still have this budget. What do you do? And I think what's going to happen more and more is that the money stays in the family and we hire family members to provide care. In my family, my parents hired my niece, my nephew, and my sister to provide care over the period of time of 2.5 years. I started thinking about this in 2019. We saw it happen in my family in 2020. And then in 2021, I started offering a free monthly planning session for families to think through how do they hire someone in the family to provide care. We will hire care, but I think it's going to be more of a moment in time solution. I've got to travel on business. I need to bring in help. So I'll hire help for a period of 3 weeks. There's another family emergency. I need to hire help. So I'll hire help for temporary time until I've figured out how to resolve that other emergency. Could be that maybe I'll hire help around the holidays or when I need to take time off in a vacation. It's going to be a moment in time. But the consistent help is going to come from the family. And we're going to look at the budget that's available. And it could be the budget the caree has. It could be the budget other members of the family have. And that becomes a pool. We're going to use that budget to look at who in the family could be hired to provide care. So the money is going to stay, I think, within the family. And I also think we're going to be very particular about who we spend money on. We're going to look to spend money on organizations that have diversity, that have family caregiver representation. And I also think we are becoming very savvy about how hard it is to be a professional direct care worker and have a good life, because the wages are below what we would consider paying someone so they can have a good life. We are very savvy about that. So we're going to look to the agencies that pay more. This came out of that survey too, that I had just shared around our spending habits. One of the survey respondents said, I hired help through an agency that paid $25 an hour, and I was not happy. I then started using an agency that pays $30 an hour, and I was much happier. She saw the difference because there was more reliability with the direct care workers who were receiving a higher wage. We're going to value that. We also are going to look to the organizations that speak our language. Think about this. We are the largest group of healthcare providers as family caregivers. So we have a particular way of looking at our day, at our week, at our month, and our life because of our caregiving experience. And we're going to look to do business with an organization that understands that. So could it look like this? A family creates its own small business entity, an LLC. Every year, members of the family contribute to that business. That business hires a family member who completes one of our training programs, the Certified Family Care Manager program. The business pays out a salary and benefits to that family member. And because on an annual basis, family members are contributing and investing in that business, there's money for a salary and for benefits. And what if that certified family care manager, that family member who's been hired by the family system to provide care, also starts a small business and they take a training program like our specialist training program, and they become a virtual assistant to support other family caregivers. And then they have a revenue stream that goes into that LLC. Could family members who are still working have a rotation of who takes a family medical leave throughout the year? If there's 4 family members who are participating in the caregiving situation, what if each took 3 months off every year? Now, in some families, this isn't going to happen. In some, it could be a possibility. And what if it's actually an extended family? Rather than siblings, it becomes cousins. And then their cousins, and then their cousins. Because we're going to have to figure out a way to make this happen and keep our jobs. But what's the cost to the business if on a regular basis, employees are taking a family medical leave in order to provide care? I was talking to a colleague, not really even about caregiving. And she said, oh yeah, this happens in our department all the time. There's always someone on leave because of a personal caregiving situation, always. How does a business sustain itself if there's this constant up and down of who's actually at work? What's the cost to the business? So we talked a little bit about the cost to the family caregiver in terms of their health, their stress number. We looked at the cost to the community. We are not spending money in the community like we did. The employer has a cost too. We also, as family caregivers, understand what it's like to be marginalized. And so we're going to look to support organizations that really value diversity and inclusion. We've experienced it ourselves, and we've also experienced it on behalf of our carees. We know how painful it is to be excluded. We're going to support organizations that value inclusion. We're going to distrust the systems, but look to individuals within the system that we can believe. So we're going to categorize the healthcare system as a system we don't necessarily trust, or the payer system We have to interact with those systems. So we're going to look for individuals within those systems that we feel like, okay, this home health nurse is amazing. I want to keep her. She's a resource for me. I want to take care of her. And it could be that we are just really kind and accommodating and make sure that she has everything she needs when she comes to our house. When we see a resource within the system that we know is helpful, reliable, dependable, we're going to take care of that resource. So we're going to look for individuals who can offer us solutions rather than an entire organization, because we see what it's like to try to navigate an organization. So we're going to look for an ally within the organization, and that includes an ally for us in the workplace. We're going to struggle with talking about caregiving with our manager, for instance, worried about what's the impact on our career. So maybe before we talk to our manager, we talk to a colleague or a coworker and say, how did you talk about this with your manager? We added our mentor training just recently in our catalog of programs because I really believe we need caregiving mentors in the workplace, in our communities, and online. The best resource for a family caregiver is another family caregiver. And all the training programs I've developed over the years really capitalize on that. And there's different ways that family caregivers can connect to a resource who is a family caregiver. And one of them now is a mentor. So just imagine you're at your job, something has happened in the family, and you're thinking through who could help me figure out how to talk about it with my manager, work through the benefits, start using benefits that can help. And then you get an internal newsletter from HR or some other department, and it says, we have a caregiving mentor program. If you are worried about someone in your family, connect to a mentor. You would say, oh my gosh, I can connect to a mentor. I don't have to go to HR. I don't have to go to my manager. I just have to connect to this mentor. Okay, so let's think about some solutions. And feel free to post any questions in the chat room. And again, I'll share the PowerPoint when I post the archive tomorrow. So this is the graphic when there are solutions and support and help for the family caregiver. We're back in the community. We're connected, we're spending money, we're engaged. We are back. That's what support and help and services for us does. It brings money back into our communities. When I think about how will we care, I think about AI. I'm not sure how AI is going to actually impact us. I'm still thinking through that. One thing that we've added in all our training programs is actually an exercise using AI. So our training program participants have to do some research and they have to use AI. So what if it makes it easier to find resources? So rather than trying to make a phone call during our workday, we use AI in the evening to find resources. I think the huge opportunity with AI is to actually get a faster, more accurate diagnosis. Last week, we had a conversation with a couple family caregivers about their path to the diagnosis for their carees, and it's a nightmare. It's a nightmare. And for many, it can take 5 years to get the correct diagnosis. And that's 5 years that costs quality of life for caree, family caregiver, and the family system, and costs the healthcare system. If we can actually diagnose correctly, more quickly, it's better for everyone. And that might be the opportunity with AI. The value of the learned experience is becoming huge now. It became popular within substance abuse recovery programs. So if you think about Alcoholics Anonymous, that's really tapping into learned experience to help others. So if I were someone who was able to get sober, I could be a sponsor to help someone else get sober. And I understand the struggle that it takes to get sober, for instance, which is why, as a peer support, I can offer really helpful insights and empathy. It's the same with family caregivers. The best resource for a family caregiver is someone who understands what it's like, who doesn't should on them. You know what you should do? Who doesn't just discount the experience, who doesn't ask the family caregiver to defend the decisions. Why are you doing it that way? Who just accepts it because they know how hard it is. This is becoming huge. These auxiliary personnel, like caregiving coaches, community health workers. Medicaid was one of the first payers to start to reimburse community health workers. And now it's going to be Medicare. And I'll tell you about that in just a minute. The other thing is, remember we talked about the wait to see a therapist? And I think we're going to look to what are the other solutions that can help and provide support while someone is waiting to see a therapist. And I thought about this with my sister. My mom died, actually, my brother died, my mom died, and my dad died, all within a period of 2 years. My brother's death was unexpected. And then a year later, my mom died. 2 years later, my dad died. After my dad died, my sister really started to struggle. And it was around the grief for my mom, even though my mom had died 14 months earlier. But you know what it's like. You don't have time to grieve because you're still in a caregiving situation. So she went through the search to find a therapist. It was a therapist covered by her husband's insurance. It was a therapist that was located near her. It was a therapist that had availability when she had availability. It was a nightmare. What if there was someone who's not a therapist, but actually offers support? And that's a professional listening artist. We started doing caregiving listening sessions regularly as a volunteer project. And because of that success, I started thinking about, you know what? There's a professional who's a listening artist that can receive the stories of our terrible days, receive the stories of our worries, receive the stories so that our speaking partner releases them. And then they can go back to their day. And the goal is that this becomes a profession that's covered through an employee assistance program, or that can be used to be reimbursed through a flexible savings account. And you know what? Probably 4 years ago, I think we all would have thought, that is so crazy. What are you talking about? That'll never happen. So what happened is that Medicare looked to, this is really interesting, they looked to what's not working within our systems, saw the shortage, and then decided, you know what, there is a talent pool of professionals that can deliver supportive services and be reimbursed for that. So starting in 2024, there's a Medicare Part B service. And because it's Medicare Part B, it's offered through traditional Medicare and Medicare Advantage. And it's provided by community health workers and other trained auxiliary personnel, like our certified caregiving consultants. So these supportive services could help a family caregiver find programs and services, help them with stress and coping strategies. It could be that a patient and a family caregiver, let's say husband and wife, go to the same doctor. A doctor does an initial screening. Because of the screening, determines that the patient could use support and the spouse who's caregiving could use support. So both of them could receive support through a community health worker, a certified caregiving consultant, a peer support specialist, whatever is appropriate, and Medicare will pay for it. So perhaps the patient receives support around finding support groups for their disease process and transportation to their doctor's appointment. The community health worker does all that research and is reimbursed for doing it and provides these solutions to the patient. And then perhaps there's another certified caregiving consultant or community health worker who works with the family caregiver around managing the stress, putting together coping strategies, figuring out how to take a regular break, connecting that family caregiver to support groups. Amazing, amazing. If you are in a clinic or you are a practicing physician and you'd like help thinking through how to add this in your clinic or practice, reach out. I have been studying, I have been attending conferences, I have been talking to everyone about this. I'm in conversations with a couple other organizations about how to add this service to their clinic, and I'd be happy to talk to you about it as well. In addition, there's training for family caregivers. So a doctor could refer that family caregiver to a home health agency, and an OT or a PT could provide training for that family caregiver. What's great about these services is that Medicare reimburses, and there's billing codes that mean other payers could start to offer these services and reimburse for them. And again, it's auxiliary personnel. It's huge. It's the lived experience that now is professional and reimbursable. Okay, so I just talked about how actually Medicare is changing things, but it's changing things because of what it saw was changing. And that is that there is a need and a value for individuals who have a lived experience, who go through a training program, who make a difference, who make an impact. It couldn't have happened unless individuals started to do that. In Indiana, the state has not been able to balance its budget, so is looking to cut programs. And one of the programs it's going to cut is a program that reimburses parents for providing care to their medically fragile children. And the parents in Indiana have been really effective about advocating on behalf of their needs so that the services continue. I don't know if it's going to help, but they are very organized. And I'll share a link to an article that came out today about their latest advocacy efforts so you can watch. So you can pay attention. What I think is interesting, though, it's family caregivers, parent caregivers who have organized to create this advocacy effort. And what I want to ask is, where are the national caregiving organizations? They are not involved in this. And I really am getting frustrated that our national caregiving organizations don't get involved to help out family caregivers where it matters. A national caregiving organization that focuses on advocacy efforts could get behind these parents in Indiana to help them. And when they help families in Indiana keep this benefit, they then have a roadmap to help families in other states, because this is not going to just happen once in Indiana. States are going to feel the pressure to manage and balance their budget, and they're going to look to programs like this Medicaid program in Indiana that reimburses parents. And they're going to say, oops, we can't balance our budget. We have to cut services. We have to cut from this budget. And so this is who it's going to impact. It's upsetting, aggravating, and frustrating to me that we have national caregiving organizations that don't step in to help. Honestly, it could make me cry. We need to also put the pressure on any organization that is touting that they represent the interests of family caregivers. And if they are silent on issues like this, we need to call them on it, because this is huge. And again, it's not just going to happen in Indiana. Okay, I just wanted to mention something that I always think is interesting. and not in necessarily a good way. I guess this is really about, we do figure out solutions, but why do we have to figure out these solutions? So GoFundMe has become a solution for our inability to pay our medical bills. And I read an article a couple years ago that I always think about, and that is how our community will step forward and help us if they can. And there was an owner of a donut shop in LA who had to close early every day because he was caring for his sick wife. And so customers figured that out. So what they did was showed up every day to buy all his donuts. And they bought all his donuts out early. So he made his revenue and he was able to close his shop to get home to take care of his wife. So let's just close with some ideas. The big one is let's fund the family caregiver. And I think there are ways to do it, like basic income, guaranteed income for family caregivers. This is something that has taken hold over the past, I would say, 5 or 6 years. There was an experiment in Stockton, California, where a group of individuals received, I believe it was $500 a month over a period of 1 or 2 years. And they tracked what happened when individuals received a guaranteed amount of money every month. And guess what? They found work. Makes sense, right? They had gas for their car. They had clothes to wear for interviews. It increased employment. If a caregiving situation is a threat to our basic needs, then a guaranteed basic income is a solution. And it doesn't necessarily cost because it helps us then invest back into our communities. If you have $500 a month, that's guaranteed, you have less stress. Instead of the stress saying, I can't go out, I just can't do it, you instead say, oh my gosh, I feel a little better. I'm going to go out. I'm going to buy myself a cup of coffee. I'm going to go and have a donut. Guaranteed basic income. It's been used for parents of young children, and I think it's going to start to move into the family caregiver space. We've been looking at hospital at home. This is something that may or may not happen because it's a demonstration project. So we'll have to see what the payers decide about this. But I do think that we're going to look at more care happening at home because of technology. And I think we also have to look at what's the impact of family caregivers. And if we're looking at bringing care to the home, we also have to look to how do we support the family caregiver? And that's where that lived experience of the trained auxiliary personnel helps. So adding a caregiving coach on the patient care team, on the palliative care team, on the hospice team. I also think we can look to, I believe, community gardens. I've been thinking about this one since the pandemic, so the past 3 years. I think there's really a nice opportunity for us to think about unused space that becomes a community garden that's a destination for family caregivers and carees. And it's also an opportunity for them to connect with each other. And then it becomes a natural co-op. So individuals who are going to this community garden then can figure out, you know what, let's share some costs. Maybe we should start to think about who do we order supplies from and how do we make that affordable for everyone? And then maybe there's this mobile caregiving unit that is stationed by the community garden that goes out once in a while and connects with family caregivers and carees to make sure they have what they need. I believe every community needs a caregiving department. So within a township, a government office, there is someone on staff who's a former family caregiver, who's taken training, and who helps members of the community complete a family emergency planning session every year. Every year. I actually have a colleague that pitched this idea just last week to her local township, so I'll keep you posted on that. So let's think through what's the shift in home care and long-term care. What if we think about a community as being the client rather than an individual. So if we have a team, for instance, that is assigned to a neighborhood, rather than having a direct care worker drive all around, they just are part of a neighborhood. What would that look like? How would that drive down costs? How would that increase quality? I also think we could look at virtual visits from home health aides, because sometimes we need guidance when we are, for instance, giving our caree a shower for the first time, or doing some kind of transfer from bed to wheelchair, and we haven't done it before. But there might not be the availability of a home health aide. But what if it was virtual, where we just connected and they said, here's what you do? You know, this shift with long-term care is going to be significant. There's a couple different pressure points. And I also think one of the pressure points is that we are thinking differently about placement. It's still in our head what happened during the pandemic. And the other piece of this is staff that looked to a long-term care facility as an employer might look elsewhere. They might not think that that's a viable employer any longer because there's not enough staff. So if you are the staff, the remaining staff, you're working long hours without a big boost in pay, and you're caring for more patients. Now, there is a mandate that's coming down that's going to change that, but it's going to take a couple years. In addition, I think we're also going to see that a lot of placement services are going to feel the pressure from us deciding, you know what, this placement service is inundating me with phone calls and emails, and I'm just trying to figure out where's a memory care unit for my mom. I think we're going to start to move away from that. Okay, so let's get a little specific and then I'll open up for questions. So I think our entertainment, like our restaurants, are really going to think through what's the restaurant environment for family caregivers and carees, because it's not the restaurant that plays a lot of loud music that has tables right on top of each other. I think that was one of the things that was so great about the pandemic, is that we started to space things out. And if there's more space between tables, there's more room for a wheelchair. There's more room for someone with a walker. I used to always fly Southwest when I was caring for my parents because there was always something that happened and I would have to return home. And the easiest way for me to get home is if I flew Southwest. Other airlines were difficult to work with. You think about our houses of worship, which are already feeling the lack of attendance. What if they switched up how and when they offer services? And here's something too that I think we haven't quite clicked and connected about with employers. We are customers. We are clients. We are in a personal caregiving situation, which means that our schedule is erratic. And we want businesses to stay open longer or on the weekends, because that might be when we have the time. An employer has family caregivers who are employees who might have an erratic schedule and might also be available in the evening and on weekends. And what if the solution became that it's not necessarily just remote work, but it's truly flexible work hours? Because if you have flexible work hours for your employees who are caregiving, you also have flexible hours for your clients and customers who are family caregivers. It's a win-win. And I really believe that every organization, community-based, employer-based, house of worship, you name it, everybody needs a chief caregiving officer who has programs and services that support customers, employees, parishioners, residents, neighbors. Okay. Just a couple other things I just want to mention, and that is there is a Protecting Family Caregivers Discrimination Act, And again, I'll share these slides so you'll be able to see this. But it protects family caregivers from retaliation. And this is going to be important, and it's going to become more critical. The other piece of this is employers must keep family caregivers as employees because everybody's going to be a family caregiver. So they have to figure out how to make adjustments so the employees stay employees. If you want employees to stay employees, then you help family caregivers because your employees are family caregivers. We are the largest group of healthcare providers and the largest group of customers, employees, and community members. That's us. Probably about 20 years ago, I was at a conference and I was in the washroom just chit-chatting, and it was with a colleague who at that time led one of the national caregiving organizations. And she said to me, this is so interesting that family caregivers haven't really connected and risen up as a movement like the moms. The moms were a big movement back then, and they made a big impression on how advertising dollars were spent. They would boycott organizations and companies that created products or services that they didn't believe in. And she said, why don't family caregivers do that? And I said, it's because we've been so mad at our sister for not helping that we don't have any energy left to be angry about the community that doesn't help us, the healthcare system that doesn't help us. And you know what? That is changing. That is changing. We're still going to be mad at our sister for not helping. And we are now at a point where it's not tolerable. And that's going to really drive us to make an impact. And we are going to see that our numbers are going to talk for us because we are the largest group of a healthcare provider. We comprise the largest number of customers, employees, and community members. And we're going to organize those numbers so that it has to change. Okay. So I'd love to hear any thoughts, questions you might have about what we just talked about. What do you think? What stood out for you? What would you like to learn a little bit more about?
Hi, Denise. Great presentation. Thank you. One question I have is, I have two questions, I think. One is, do you think that there is opportunity for placement, not placement service, but what I mean is to help recruit people who are doing direct care? Because as you said, my lived experience is that they are so hard to find. I don't know if that means they're just not there, or maybe there are other populations that could be recruited from. And so I'm wondering if, if that's a possibility, or if that might be kind of down the pipeline, better, more efficient ways to actually recruit people who are to do the hands-on work. So that's question one. And then question two is just about, okay, forgive me, Denise, I'm having a moment, meaning I got to come back to question two. So if we have time, I'll ask the second question because I forget exactly what it was and the way I wanted to answer it. But my main thing was, because you talked about family systems and family members taking on, but what about those families who people are all across the country and they're not there with the caree, and so they really do need those direct hands-on people because they just can't do it all. So that's one.
Yeah, there just isn't a pool to pull from.
Yeah.
And in order for us to create a talent pool, we have to really be committed to paying more and creating better benefits and creating better career opportunities. I'll give you an example. I have been trying to have home care agencies create a career path for their direct care workers. And so I created this career path and I met with large organizations who are franchise owners. And I met with their leadership team and I said, I can help you create a path that will help you attract and retain a larger pool of talent. Because that's one of the things. If you are a direct care worker, there is no career advancement. You are a direct care worker for 40 years. You're going to age out of that work. And that's horrible because you're going to have all this knowledge and expertise and you're going to be stuck in the same job. So I said, let's train direct care workers to become caregiving coaches for each other and for family caregivers. Let's create this career path. And the resistance to doing that was mind-boggling to me.
I believe you.
The leadership team at one organization said to me, we're not going to do that because we have only a handful of really great direct care workers, and we're not going to take them out of what they do because we don't have anybody to replace them. Now, that's very short-sighted. You could say it's almost inhumane. It just makes me so mad. It makes me clench my fists. I get so mad about it. But that's the mindset that we're working with. Now, we also know that there is the underground market, for lack of a better way to say it, of direct care workers who don't work for an agency that can be hired directly from a family. And there are ways that you can hire a direct care worker like care.com and carelinks.com. So you hire directly. That is a solution. It's also managing then a team. And that's a lot of work. And it's also trying to find the right fit. And that's a lot of work. We just haven't figured out this solution. And the unfortunate thing is we knew it was going to be a problem and we never decided to really commit to a solution. We just said, it's going to be a problem. Well, now it's not just a problem, it's a catastrophe. And certainly, if it's a long distance family caregiver who's worried about a mom in California and they live in Florida, it's a huge worry about what do we do? Who takes care of mom? And again, that's when I start to think, okay, it's that family taking turns, where it could be that each family member takes a leave of absence, goes and lives in California to take care of mom for 3 months. And then someone else in the family takes over for 3 months. I was at a conference last week in Carbondale, Illinois, and one of the attendees said that she has a colleague who actually moves their mom into a family member's home every 3 or 4 months. And so rather than the family moving, they just move their caree every 3 or 4 months into a family member's home. And
Wow.
that's how they figured out to provide care for her.
Mm-hmm.
Yeah. It's a huge problem. It's a huge problem. And I think it's hard to be a direct care worker. I think I would think twice about staying in that job for a long period of time.
And the thing about it is the facilities have the exact same problem. So
Yeah.
the fact that they are a facility doesn't ease the issue.
Mm-mm. No. And one of the problems is facilities actually can't take admissions because they don't have the staff. And now that there's a mandate for what their staffing ratios are, they're going to really be limited in their admissions. Now, that mandate does take a couple of years to actually take effect. So it's, even though the mandate is in effect, it's not impacted yet. But we don't have a career path if you're a direct care worker. And that's sinful. To have an expectation that someone does the same job in and out, unless it's their choice and they want to and they love it, but they should have an option. And there is no option if you're a direct care worker. That's what you do. And the toll on the body makes it very difficult after a period of time to continue doing that job.
Absolutely. I've experienced that. All
Yeah,
of that you've said that. Mm-hmm.
yeah, yeah. It's it's sinful. It's sinful. It's
Absolutely, it is.
it's the same problem on the other end with childcare.
Mm-hmm.
We've done the same thing.
Mm-hmm. Got to figure that out though, because if more of us are aging, like I'm at an age that I'm still working. You know, I have an employer, yet at the same time, I don't think my employer would be particularly friendly or open to me taking, you know what I mean? Like,
Of course.
it,
Yep.
yeah, I don't.
Yep.
So because I
Yep.
need to work, I kind of have to stay on whatever side of the line.
Right.
So it's tough. And with more of us getting older, I have my own mobility issues, if you will, such that direct caretaking, provide, is challenging for me. So yeah, but yeah, yeah, you're so right, so right.
It's just that there is not going to be any, well, maybe anymore. Because if we want our businesses to stay in business, if we want our communities to flourish, if we want quality of life within our family systems, things have to change. And again, there's pressure on changing things. And I think about Medicare reimbursing auxiliary personnel as one of the bigger indicators that what we thought was impossible and would never happen is possible. We have to keep pushing, thinking outside the box, challenging ourselves, challenging others. The status quo is not acceptable.
So agree.
Any other last questions before we close? Okay, I'm going to close this. Thank you guys so much for joining me live. I so appreciate it. And I'll send out the archive tomorrow. And I look forward to connecting with you about this again. I think we all have important perspectives and ideas and needs. And it's helpful that we all get together to talk about this because this is how we create the movement and the momentum. Okay, thanks everyone.
Have a great day.
You too. Bye-bye.